Welcome to Financial Insider Weekly. I'm your host, Michael Gray, CPA. My guest today is Don Pollard. Don is a chartered life underwriter and chartered financial consultant, and he's an insurance broker at Advanced Professionals. It's a regional insurance brokerage company headquartered in Northern California, serving about 350 clients. The company offers employee benefits, and executive life and disability insurance planning. Don has worked in the insurance industry since 1973, and Advanced Professionals, he's been there for about 16 years. He's managed insurance agencies and trained agents. Don is a past president of the Silicon Valley chapter of the National Association of Insurance and Financial Advisors. So because health care insurance is such a critical area, we're covering this, and particularly today we're going to be talking about group medical insurance for small businesses. And so in that process, before we get started, I want to mention that rules for medical insurance vary from state to state. So be sure to work with a consultant who is familiar with your state laws. We do have people who watch this, Don, outside of California. Okay, Don, welcome.
Thanks, Mike.
Thank you for joining me today.
Good to be here. Thank you.
Okay. Well, this is a very important topic we're talking about. So, why should small businesses reassess whether to offer group medical insurance to their employees?
Well, first of all, Mike, let's talk about the definition of a small business.
Okay.
In the state of California, it's 50 full-time employees or less. And these employers are not going to be affected by the mandate in the Affordable Care Act to provide coverage for their employees. So basically all small business employers will have the option without chance for penalty of discontinuing their plan and allowing their employees to shop for their coverage through the exchange. The exchanges are set up and will be effective January 1, and what they will allow is any individual person to purchase an array of benefit plans and on a guaranteed issue basis, which means no one can be declined insurance because of any kind of past medical history or pre-existing condition, as we in the business call them. Mm-hmm. So a great time to reassess and also to help your employees to understand what their options are.
Now, when will the employees have this option of being able to get coverage for themselves?
Well, this part of the law becomes effective January 1st of 2014, so 250 or so days from now. The opportunity to first take a look and to first sign up for exchange policies begins in October of this year and runs through end of March in 2014.
Okay. So what is the employer coverage mandate?
Well, the Affordable Care Act requires employers of greater than 50 full-time equivalent employees to offer an essential level of benefits for the plans that they offer, and that the coverage must be deemed to be affordable for the employee. So they have to provide a certain level of essential benefits, which have been defined, and then that level of benefits, the structure also must be affordable to the employee in order for them to comply with the mandate.
Okay. What is the safe harbor in order to avoid penalties?
The safe harbor is that if the employer provides coverage for an employee only, and if the employee's share of the premium for that coverage is less than 9.5% of their pay, they will be deemed to have complied with the law.
Okay, so in other words, the employee their share would be 9.5% or less of their...
Right, 9.5%, and
okay.
then the employer then has provided that. Now, you know, the interesting factor here is that that there's been no actual decisions regarding family coverage. So the family coverage is not covered in this at all. So.
Okay, okay. What is the potential penalty that could apply to an employer? Now again, we're talking about people that have 50 or more employees.
50 or more full-time equivalent employees.
Okay.
And that penalty is $2,000 annually, and it's assessed on a monthly basis, so about $167 per month.
And it's per employee that...
Yeah, per employee that you have working there. So it's a substantial thing, and again, I think that a calculation is prudent to be done here, just so you know whether you're better off to just pay the penalty or whether you're better off to have the coverage.
I see.
And that's strictly a financial question there. I mean, you know, there's the other piece that says I want to help my employees, you know, to an extent by helping them to get this important coverage, which basically they couldn't, you know, you can't really effectively plan for catastrophic medical expenses. It's just not possible, you know. So there's a I don't want to call it a moral aspect, but there's a value-driven aspect of providing these kinds of benefits for their employee.
And right now there's a tax benefit. I mean, so the employees get this coverage on a pre-tax basis in many cases, and so they're saving income taxes by having the employer provide the coverage.
Definite tax leverage the way the current setup is now. Now, I was recently in Washington, D.C. at a fly-in where we went over and visited with our Congress people regarding maintaining the deduction, the health insurance deduction, which again is huge. It's deductible to the employer, non-reportable to the employee. So that's a favorable tax situation, and also a huge tax preference item. And I'm not sure what the government calls it, but they're losing revenue on this.
Yeah, and there has been some talk about having it be taxable.
Yeah.
I don't think personally that will get through, at least not in the foreseeable future, but you know, they're looking for ways to raise revenue, and depending on what happens, you know, in the mix of Congress and the White House and so forth, things could happen in the future.
Well, I think what does have a chance of getting through is some kind of a cap on the amount of medical insurance premium that is deductible for an individual.
Yeah.
So this, you know, basically some of these real high-end plans are probably not going to be effective in the future.
Yeah, so there are some, if you will, executives that get gold-plated coverage.
Cadillac plans.
Yeah, they get the Cadillac plan, and then the other employees may have a more average type of a plan, and so how much of an exclusion they're going to continue to get related to that. It's going to be the same thing as fighting for people getting their lunch exclusion here in Silicon Valley. So anyway.
I didn't know we had one of those.
Yeah, that's for the people who are having lunch provided at the work site. So they're having some controversy related to that right now. By the way, folks, today is April 23rd, 2013, if you're wondering, you know, when this is all happening, this discussion. All right, well, let's talk about the rating system for a few minutes. How are changes in the rating system going to affect employers that provide coverage to their employees?
Well, the current system for small group employees basically has an age-banded type of a system, and there's 8 or 9 age bands right now. And of course, the older you are, the higher the premium. And currently, there is no limitation between those bands. So there's no limitation on the relationship of the low cost versus the high cost. And what the ACA has done is required no more than a 3-to-1 differential between the lowest cost plan for a
certain age group.
Well, not age group, but a employee you know, status, either the employee or the family. And so we have a compression then of the total width of the bands, and we have certainly a reduction because currently, you know, it could be a 7-to-1 spread between a person 65 and a person 25, based on the premium. Now that's going to be compressed down to 3-to-1. So that's going to have an effect. Again, I don't know that we know exactly what the effect will be until we see the rates, which we've been told we'll be getting in July of this year. Also, they've changed between 9 regional ratings where they had different premiums for different regions. Now we're going to go to 19 regions, so that's becoming more finely tuned. And then the other piece, which I mean, it's hard to tell, in my opinion, what's going to be the effect of this, but that is that each family member moving forward is going to be rated. So if you have a man and his wife, so you have a husband and a spouse, those two people will be rated based on their age, and then each child that they have added on will be rated at their particular age as well. So all 4 of those rates will be what's charged. And so that's different than what we have today. So what currently we have today is just you pay one rate for a family, and that includes your spouse and as many children as you may want to have. And then, or if you have child-only coverage, it's either for 1 child or for 6. Doesn't matter. So that's going to be a difference, and that might possibly show an opportunity for savings to people that are covering fewer children than greater children. But again, I don't think we can really tell until we see what the rates are going to be and then actually do a calculation.
Yeah, but I think what we are saying is that a family where you have, let's say, 2 children, they are certainly going to be paying less for their coverage than a family that has 6 children, because there's going to be a rating for each child. That's
correct. Yeah, on the new system, that's right. They would definitely be paying less because they'll only be charged for 2 of those instead of 6.
Right. All right. What are some differences in how this is going to be implemented in California compared to the federal requirements?
California has actually two major differences, and that is, under the federal law, the wait period that an employer can apply to a newly hired employee is 90 days under the federal law. But under the California state law, that is only 60 days. So we have a more favorable, if you will, for the new participant or the new employee at 60 days. And also under the federal law, there's an ability for the companies to rate up based on a person's smoking status, which under California law we don't allow that. So there's no opportunity to rate up if the person is found out to be a smoker or if they admit to it.
So when we say rate up, what we mean is that people who are smokers in other parts of the country will probably be paying more for their insurance.
Well, the allowed amount is 50% more than the standard rate. So, and my assumption is that anybody, they would take full advantage of that 50% number. You know, so if the standard premium is $200, the premium for a smoker is $300.
Right. Okay, so why is January 1st, 2014 important related to this whole thing?
Well, that's when the final aspects of the plan, become effective.
The healthcare reform.
The healthcare reform plan, which was passed several years ago, and we've been kind of, certain provisions have been become effective along the way, and now this is where the big amount, the exchange, comes in. And that
the employer mandate and the other
things. Mandates, yeah.
Okay. So what are exchanges, and how do they relate to this whole thing with employers?
Well, exchange is an organization that was created under the ACA, and the idea of the exchange is that it's a place where they're going to aggregate base coverage and providers of coverage to allow people to have a choice of what kind of plans and who the various providers are. of those plans. So there's a comparison matrix that will be developed that will allow people the opportunity to easily compare between plans. The exchange is also tasked to provide an effective way for people to enroll in the plans. So they're going to provide information, they're going to give an opportunity for multiple plans, and they're going to give people the chance to sign up for those plans. Mm-hmm. The other benefit of this is that the exchange, because of the nature of the exchange being that it's for individuals or for groups, is that we are going to effectively de-link the access to quality medical coverage from employment, which has long been a problem for many people.
Right. So if they weren't employed, then they couldn't get coverage, and now we've got guaranteed issues. So again, pre-existing conditions aren't going to be a block to getting health care.
That's right.
Yeah.
Yeah, and what we used to have was that people were involved in job lock, where they couldn't change jobs because they had pre-existing conditions, and therefore when they went to a new company, they couldn't get on the plan because it had a pre-existing condition exclusion. So our state law dealt with that, and now we're going to eliminate pre-existing condition exclusions for individual people as well. Mm-hmm. So a big step forward there.
Okay. What are the essential benefits that are required to be included in the plans when they're participating in this exchange?
They've the ACA has developed and now recently broadcast what those are, and basically the required coverage is going to be for doctor visits, hospital, obviously emergency care, maternity coverage, pediatric care, RX, prescription drugs, lab work, preventive, which is already in effect currently, and then mental health benefits. So moving forward, each plan that is offered is going to be required to provide benefits in those areas. So that's going to be a tremendous difference too in some areas.
So you've been throwing out ACA, so maybe you should just tell us briefly, what is ACA?
ACA is an abbreviation, an acronym for the Affordable Care Act,
okay,
which is
it's the law that...
Actually, it's the PPACA, Patient Protection and Affordable Care Act, shortened to ACA. Maybe someday it'll just get to A.
Okay. Now, also, aren't there some levels of coverage that are going to be available through these exchanges?
Yeah, so that's the second part of the standardization, if you will, of the benefits offerings, and that is that each exchange will be required to offer a 4 varying levels of coverage. So they've nicknamed them, or they've named them metals. So bronze level, silver level, gold, and then platinum, and each of these relates to an actuarial percentage of the estimated costs of health care for that person. So for example, the bronze plan, which is a 60% plan, is designed to actuarially pay for 60% of the expenses that a person might have in that year. Mm-hmm. And again, it's an actuarial, which means that they've assessed a large group of people to determine what the average costs are, and then they apply the benefits to it.
And so part of what people need to decide is, if you will, what percentage that they're going to devote to health insurance, and then that by investing more in health insurance, then it will provide more benefits as far as the medical expenses that it will cover. And so you've got a balancing act that you've got there.
Yeah, and that's a good point. And I think this is the reason why this is a great opportunity for everybody to take a look and see what's going on, because there isn't any reason to buy more medical insurance than you need, because the excess cost or the excess price of that just goes to someone else's else's pocketbook. So if you can, and this is not changed from before, the more insurance you have, which I'm going to define as when you go to the doctor you pay less, the more that costs you every month. So you know, there should be a balance somewhere in between there that says, you know, I'm willing to pay a little more, willing to take a chance of paying a little more, and pay a little less as I go.
Yeah.
So everybody will make that, and these exchanges will now make this an easier decision or calculation.
Okay. So we're not, most of us aren't health insurance specialists. We don't really necessarily understand how all this stuff works. How do we get help?
Well, there's multiple ways to access the information of the new programs, and I think probably the best place to start would be at the website, which I think is going to be up on the screen here if it's not already, or their phone number, which is also available there. And they have a lot of really good information. It's pretty clear and concise about the plans that are going to be available, the levels of benefit, the metal plans, bronze, silver, and then the essential benefits. And then also information about how to actually get signed up for those. And then there's information for small business owners as well, relative to some of the benefits and the reasons why they would do it. So it's pretty comprehensive. Of course, it is a website, so it has its limitations in that area. And there's also going to be an opportunity for people to use what I'm going to call assisters, which are people that typically work for nonprofits or hospitals or that kind of thing, and they're non-licensed, and so their task is to help people gain information and effectively enroll. If you want professional expertise, if you want recommendations for what type fits you the best, that would be what you'll get from a professional insurance agent who has a license and can basically describe the different factors of the plans and to gather information about your personal situation and give you a recommendation as to which plan is going to meet your needs in the best way.
Okay. So we just have maybe about 4 minutes left, just so that you know. Let's talk about tax credits for a few minutes. What tax credits are going to be available for employers under the federal health care reform?
Well, a small employer has the ability to have a tax credit starting in 2014 of 50% of the premium. Now, let me hurry up to tell you that this is based on a sliding scale, and it's also based on the income of the people that work for you. So basically, it's a calculation that you would need to work with your CPA or with your insurance broker or in combination with all of them to basically do that calculation and see where you are relative to the cost share. But it's a potential of 50% of the premium that you pay, and again, sliding scale from 50% down to zero based on some parameters of your employee group. Nonprofits also have an availability of up to 35% of that credit.
All right. I'm just looking at some of the details here, and an eligible employer can have no more than 25 full-time employees, and the average compensation for the employees can't be greater than $50,000. So if you're hiring a bunch of engineers that you're paying $100 grand, you're not going to get a credit.
No, it's not going to. But they don't need a credit.
Yeah.
I mean, really, So yeah, it's designed for people to hire lower income people and still be able to offer them and provide them with a fantastic benefit to help them plan for their personal financial security.
So if you have like a local, I'll just start like a local bookstore, or you're not franchised with McDonald's, but you have your own hamburger operation, and so you have lower wage employees that you have working for you, but you want to provide medical care coverage for them,
Exactly.
then you can get this type of a plan and coverage and get some tax credits for it. When we say tax credits, folks, that's not a deduction. That means that you get to offset it dollar for dollar against your income tax liability.
Yeah, I think you make a good point, Mike, and you're absolutely right. Is that in Silicon Valley, where we are sitting today, there may be fewer of these opportunities than there might be somewhere else. Mm-hmm. But still, again, a reason to get together with somebody who has some information for you and can make an assessment about your situation and to help you, to guide you in that area.
Right. Don, I want to thank you so much for joining me as my guest today.
Oh, you're welcome.
And I hope you'll come and see us again and keep us up to date on what's going on as this develops. Folks, we have a totally changing picture here related to healthcare. It's really rather revolutionary. And it is going to vary about how it's being implemented from state to state. California has been more aggressive in trying to get this to work than other states. So in a sense, we Californians are fortunate for that. There are reasons for that. Actually, we're hoping that we will get more people on the bandwagon getting health care coverage. And so then the taxpayers won't have to be ponying up through Medi-Cal and other subsidies for providing that coverage for people that otherwise don't have it. Anyway, I hope you'll see us next time on Financial Insider Weekly.